In a developing story, Ascension St. John in Tulsa is now a level 1 trauma center. We've told you this makes it the only facility in Tulsa with that status. The hospital can now provide 24/7 trauma care for patients with life-threatening injuries. Joining us live in studio is Kristen Norrid, a registered nurse and program director for the new trauma center. Thank you for being with us today.
Thank you for having us.
So what does it mean for Ascension St. John to now be a registered level 1 trauma center?
So we've gone through the highest standards. The American College of Surgeons verifies trauma centers, and we have met all the standards. We all came together from administration to pre-hospital. We all saw the vision. We put in subspecialty surgeons, and we saw this out over 3 years.
3 years?
3 years.
That is a lot. What did you guys have to do to try to reach that?
So we had to expand care. We had to bring on neurosurgery, orthopedics. We expanded trauma advanced practice providers, nursing. Our administration was behind us from the beginning. And when we said we wanted to become the best, they gave us everything we needed.
You became the best.
We became the best.
That's really cool. Now, I think you said the big difference between level 2 and level 1 is research. That's the main.
That's the big standard. So St. John's has been a level 2 trauma center since 2009, and Dr. Charles is our program director, and even the director before him saw a vision of becoming the best. And so we knew we needed to bring on research, we knew we needed to bring on the best care, and so we put all those pieces together, and now we are.
So cool. So now, how does this directly impact people living in Tulsa and the surrounding areas?
So Tulsa gets the best care right in the heart of Tulsa, but we also get to expand. We get transfers from southern Kansas, western Arkansas, sometimes even up from Texas. So we're providing that highest level of care to all of the communities around us.
That's cool. You're going to be reaching other states with this level of care.
We are.
That is very, very unique. Okay. So now, how did you prepare for this certification? I mean, I know that it was 3 years in the making.
Mm-hmm. So we come together as a trauma program, and we have what's called a gray book, and it's a standard. It's the highest standards that you can meet for a trauma center. And you've got anywhere from trauma registry staff to nurses to the subspecialty surgeons in the hospital. Everybody has a standard to meet, and we got everybody together on the same page. 3 years in the making, and we had our survey, and we got it all done.
Wow, to have every different department meet that standard, that was a lot of work.
A lot of work.
A lot of work.
And I mean, administration behind us is a big piece of it. It takes an entire hospital. Everybody touches a trauma patient. And so to give the highest level of care, you've got to have everybody together, touching them, giving them care. Pre-hospital education. So we work really well with our pre-hospital EMS providers. We give the evaluation, we provide the best, highest care possible, head to toe. And then we see them through to rehab.
That's amazing. Thank you so much for talking with us today, Krista. I so appreciate it.
Thank you for having us here.